Okay, breasties, listen up. This isn't meant to scare you, but cancer is on the rise in young people. Let's talk about it. So just last week, the American Cancer Society released their 2024 Cancer Facts and Figures, and it's not good. So my name is Dr. Robin Roth, aka the Booby Docs. I'm a board-certified radiologist specializing in breast imaging, and I have been seeing increasing numbers of young people in my clinic for the past few years, and these numbers confirm that. There are going to be over 2 million cancer diagnoses this year, which is a grim statistic that we have not passed up to this point. That's over 5,500 new cancer diagnoses per day. In terms of cancer deaths, there's expected to be over 600,000 cancer deaths this year, which is about 1,600 cancer deaths a day. 4 screenable cancers are on the rise, including breast, colorectal, cervical, and prostate. We are seeing a shift of cancer patients from older individuals to middle-aged individuals. So the numbers are showing a decrease in the number of people getting diagnosed after the age of 65 and an increase in the number of people getting diagnosed before the age of 50. There is a notable rise in colon cancer before the age of 50. And there's an increased number of cancer deaths. It used to be the number 4 cause of cancer deaths in men and women before the age of 50. Now it's the first in men and the second in women. There's also a rise in cervical cancer between the ages of 30 to 44 and a decrease in women who are younger than that, which means that they benefited from the HPV vaccine. Let's talk specifically about breast cancer. There are projected to be over 310,000 new cases of invasive breast cancer in women and almost 2,800 cases in men this year, plus another over 56,000 cases of DCIS or early breast cancer. There is a rise in breast cancer, and that number is slightly higher in women under the age of 50. There is an increasing incidence in breast cancer since the 2000s, likely due to increased body weight, inactivity, and also birth trends, meaning later age to have kids and less children. Thankfully, mortality rates have been decreasing by over 42% over the last few decades, thanks to early detection from mammograms, increased breast cancer awareness, and improved treatments. This has led to almost 500,000 decreased breast cancer deaths. The death rate is declining about 1% per year, and that number would be higher if we were able to overcome breast cancer disparities, because we know that Black women are about 40% more likely to die from their breast cancer than white women, despite having a lower cancer incidence. Also, breast cancer mortality ranks number 1 in women under the age of 50. The 2 greatest risk factors for developing breast cancer are being female and getting older, so we are all at risk. Other important risk factors include having a family history, especially if it's premenopausal first-degree relative or a known genetic mutation, such as BRCA1 or 2. That being said, I see that the patients that are getting diagnosed with breast cancer in my clinic are getting younger and younger, and most of them do not have the family history and known genetic mutations that we typically associate with breast cancer. So things that we can change to lower our risk of breast cancer include maintaining a healthy weight, exercising at least 30 minutes a day, limiting alcohol, having a plan-forward diet with minimizing red meat and known carcinogens. Also, breastfeeding for a year lowers our risk of breast cancer, but breast cancer is the most common cancer during pregnancy and breastfeeding. Breast cancer screening with mammography continues to play an important role. There are conflicting guidelines as to when to start mammography, but we know that annual screening mammography beginning at age 40 saves the most lives in average-risk women. High-risk women, those who have a greater than 20% lifetime risk of breast cancer, need to start breast cancer screening earlier and supplement with MRI. Breast self-awareness is key, especially because we talked about the rise in young people that have breast cancer, so doing a monthly self-breast exam does make sense, looking for lumps and any changes that don't feel right. But it's important to know that most early stage breast cancers do not present with symptoms, which is why screening with mammography is so important. Also, this report specifically mentions that although the radiation exposure from mammograms is cumulative over time, it does not meaningfully increase breast cancer risk or outweigh the benefit of screening. Mammograms save lives. Pass it on. Thankfully, about 2/3 of women are found to have early stage breast cancer, and the 5 and 10-year survival rates for breast cancer are over 90% and 85% respectively. But it's important to note that despite progress, the 5-year survival rate in Black women is 10% lower than that of white women, 83% versus 93%. Black women are more likely to be diagnosed at a later stage and with more aggressive subtypes. We need to do better. So what can we do? Well, we talked about the important lifestyle modifications that we need to do, but also stay up to date on your cancer screening. So annual mammogram, pap smear, and also colonoscopy when age appropriate, which reminds me, I have to schedule my colonoscopy. Shit. I'd love to hear your thoughts on these numbers. And as always, follow the Booby Docs for more of the breast information.